All right, in this explainer, we are going to break down the clinical understanding of what's known as obsessive-compulsive disorder, or OCD. We're going to look at what it is, where it might come from, and most importantly, the treatments that we know are really effective. So here's the plan. We'll kick things off by really defining OCD. Then we'll dive into the cycle that keeps people stuck. After that, we'll explore some of the biological and psychological ideas behind it, and we'll wrap up by looking at the #1 most effective treatment out there. Okay, so to truly get a handle on OCD, we have to start with its two core parts, obsessions and compulsions. Now, they're totally linked, but they're absolutely not the same thing. And this right here is the critical difference. Obsessions are what's happening on the inside, those intrusive, unwanted thoughts or images that just pop into your head and create a ton of anxiety. You know, like a persistent, nagging fear about germs and contamination. The compulsions, on the other hand, are the external things you do to try and shut that anxiety down. That's the constant hand washing or checking the lock over and over again. So how do these two pieces create such a powerful, self-sustaining loop? Well, this cycle is literally the engine that drives OCD, and figuring out how to break it, well, that's the whole key to effective treatment. And this is the trap. It all starts with that obsession, which of course triggers intense distress. So to get rid of that awful feeling, the person performs a compulsion. But here's the kicker. The relief you get is only temporary, but that relief is a really powerful reinforcer. The brain basically learns, hey, that ritual worked, it kept us safe. And that just makes the urge to do it again even stronger the next time the obsession hits. So what's actually happening inside our bodies to fuel this cycle? Well, research is pointing to a pretty complex mix of our genes, our brain's wiring, and our neurochemistry. The big takeaway here is that it's probably not just one single thing. The evidence suggests it's a combination of factors. For one, there's a genetic piece to the puzzle. OCD does tend to run in families. We've also seen in brain scans that certain parts of the brain, the ones involved in decision-making and filtering out impulses, are basically in overdrive. And finally, it seems like the neurotransmitter serotonin isn't quite regulated properly, which is a big reason why certain medications can help. But, biology isn't the whole story. Psychological theories give us some different angles for understanding how these patterns of thinking and behaving actually get started and then get so stuck. So the behavioral perspective looks at OCD in a really different way. It doesn't see it as some deep internal conflict. Instead, it sees it as a deeply learned response. It's all about the connections we make between everyday things and fear, and the things we learn to do to feel safe again. This is a perfect picture of Mauer's theory. First, through what we call classical conditioning, something totally neutral, like a doorknob, gets linked with a scary idea. Now, that doorknob makes you anxious. Then, through operant conditioning, you learn that an action, like washing your hands, makes that anxiety go away, and that temporary relief acts like a huge reward, which just locks that compulsive behavior in place. Now, a much older, more historical way of looking at this comes from the psychoanalytic view. It basically traced OCD all the way back to conflicts in early childhood. The theory went that obsessions and compulsions were really just the outward signs of this deep, unconscious battle between the natural impulse to be messy and an internalized, strict demand to be perfectly clean and in control. Okay, so we've looked at the symptoms and the theories behind them. Let's shift gears and talk about the most powerful, evidence-based psychological treatment that we have for OCD. And while there are different therapies out there, one specific behavioral approach really stands out from the pack. It's considered the gold standard because it directly targets and breaks that OCD cycle we've been talking about. The idea behind exposure and response prevention, or ERP, is actually pretty simple, but it is incredibly powerful. It attacks the OCD cycle head-on. Exposure just means you systematically, and with the help of a therapist, face the thoughts or situations that trigger your fear. And response prevention is the really crucial and really hard part. You have to resist the urge to do the compulsion. So for example, you might touch a contaminated doorknob and then not wash your hands. It's in that incredibly difficult moment, when you're just sitting with the anxiety, that your brain learns a brand new, vital lesson. The anxiety actually goes down all on its own, and that ritual isn't needed to stay safe. It's also really important to mention that medication often plays a key supporting role here. Things like SSRIs, which help regulate serotonin, can kind of turn down the volume on the obsessions and anxiety. And this often makes it much easier for people to really lean into the hard but life-changing work of ERP therapy.
And this all brings us to a really powerful final thought. When we look at OCD through this behavioral lens, we stop seeing it as some kind of deep character flaw. We see it for what it is, a learned cycle that's just reinforced by the promise of temporary relief. And that reframes the entire condition. It suggests that what has been learned can also be unlearned. And that right there offers a clear and incredibly hopeful path toward recovery.